Adverse childhood experiences, overdose, and suicide are public health challenges in every community across the country. By understanding the intersections of these topics and working to address risks associated with all three, we can maximize the impact of prevention efforts. Let's take a moment to understand these topics better. Adverse childhood experiences, often referred to as ACEs, are common. They include potentially traumatic events in childhood, like experiencing or witnessing violence, having a family member attempt or die by suicide, or growing up in a household with unmanaged mental health or substance use problems. Toxic stress from ACEs can change brain development and affect how the body responds to stress. And without support, ACEs cause long-lasting harm. ACEs are linked to later health problems like substance use, suicide, and depression. The increased risk of substance use can result in substance use disorder, which can increase risk for overdose. An overdose happens when a drug is taken in excessive amounts and results in injury to the body or poisoning. While not all overdoses are fatal, all overdoses come with their own emotional and economic tolls. Suicide, whether through drug overdose or other means, continues to be a leading cause of death in the United States. Unfortunately, both suicidal ideation and attempts are rising, with American deaths by suicide increasing by 33% in recent years. For children, household exposure to substance misuse in any form or losing a loved one to suicide are adverse childhood experiences. These adverse experiences, without positive support to counterbalance the weight of negative experiences, are associated with younger opioid initiation, injection drug use, and lifetime overdose. The odds of attempting suicide are 30 times higher for adults who have experienced 4 or more adverse events in childhood compared to adults who experience none. The links between ACEs, overdose, and suicide are clear, and it is only by illuminating their connections that we can effectively prevent their harm. Comprehensive public health approaches look at these issues independently and in relation to one another. Such strategies focus on prevention through systems-level changes, public education, and building on existing community strengths. By preparing communities to provide support to those who have experienced ACEs, overdose, or suicide, we can address these traumas today while preventing them tomorrow. Visit www.urgentrelatedpreventable.org to learn more.